I am Dr. Bela Shah, Professor and Head Department of Dermatology, BJ Medical College, and now a practicing dermatologist at Elizabeth. So today I'll take you through very common problem of hand eczema. So if you look at your number of patients visiting you, hand eczema remains a very common problem to consult a dermatologist. The etiology of hand eczema is varied and it will depend on the age of the patient, on the profession of the patient. It's very common disorder for which the patients will walk in any dermatological OPD. So there are so many causes of hand eczema, and by asking appropriate question to the patient, we can definitely zero down and narrow down the cause of hand eczema in a given case. So if you analyze the cases of hand eczema, it's not only common in females, but it's also quite common in adults, male adults, as well as few cases you might see even in pediatric practice. The most common cause of hand eczema is contact dermatitis. It can be either allergic contact dermatitis or it can be irritant contact dermatitis. Apart from these two common causes, you should always ask history of atopy, which can manifest as hand eczema in adolescents as well as in adults. This is also quite common, and many times you may see the patient who presents with discoid lesions on the dorsal of hands can have underlying history of atopy in herself or himself, or there can be family history of atopy. So if you look at the profession of the patients or the work pattern of the patients, you will find the most common causes or the professions wherein this hand eczema is very common is masons, hairdressers, people who are doing wet work, the maids, the pani puri walas, housewives, and so many other professions wherein the patients are exposed to lot of chemicals or they have excessive exposure to even water. That causes eczema, which manifests on the dorsal of hands. At times, patient can also have involvement of their palmar surface, and when the palmar surface is involved, you can also see dyshydrosiform eczema, you can see hyperkeratotic variant, you can see the fissured variant wherein the patient will have a lot of fissures, patients can have bleeding from those fissures. So there are variety of manifestations. And if you classify hand eczema as per the presentation, it can be acute, it can be subacute, or it can be chronic. So if the patient has got acute eczema, you will see lot of papules and vesicles which will produce lot of itching, and the patients will have oozing. And when it persists, it becomes subacute, and after 3 months, when the patient has got hyperkeratotic lesions, lichen-fed lesions, the patients are likely to develop the chronic phase of hand eczema, which manifests as a lichenoid plaques on the dorsal of hands. So there are variety of presentations as per the duration of the disease. So what are the common allergens which will give rise to contact allergic dermatitis? Nickel, chromate, these are the common allergens, and which can be detected by doing patch test. And we can find out what are the allergens which are causing hand eczema. If I recollect my data of COVID times, so many health workers and health professionals were visiting us with hand eczema because of excessive use of sanitizers. So that was a time wherein we saw so many residents, so many doctors visiting us with hand eczema because of the excessive use of hand sanitizers. So we need to remember, even hand sanitizers can cause acute eczemas. So how do we manage these patients? First of all, we have to ask the proper history, what type of work they are doing, and of course we can, if the acute eczema, in acute eczema we'll have to address with soothing compresses and topical steroid creams, and of course role of emollients is always there, whether it is acute phase, subacute phase or chronic phase of eczema. For subacute phase, naturally we will prefer to use emollients as well as mid mid-potency topical steroids. At times, patients can have secondary bacterial infection. For that, it's better to use oral antibiotics than to give steroid antibiotic topical combination creams. For chronic eczema, you have to counsel patient a lot about his daily routine, as well as the role of moisturizers should be stressed upon at every visit. For chronic lichenified lesion, we can use initially potent steroids for 15 days, then we can prescribe mid-potency steroids. If these patients fail to respond, then these are the candidates for systemic therapy. We can use for very refractory eczema even immunosuppressive, but the role of immunosuppressive is very limited, and I would say it should be not used as a first line drug for most of the cases of hand eczema. So, it is better to use emollients and appropriate topical steroid therapy, and in few cases we can also take help of calcineurin inhibitors, which are beneficial for subacute cases as well as chronic hand eczema patients.
For more such videos, visit or log into dermavidya.com.